I think there's some myths that go along with homelessness that we need to erase. So after I say each one of these, I want to hear a big bull. Can you do that? All right. Homeless people don't want housing. That's bull. Bull. Did somebody add it? Yeah, let's do it. Come on. I like you guys. I've never had a group add it. All right. I haven't met anybody that I've ever seen that didn't want housing. They might not have wanted the house that we told them they needed, but they wanted housing. They just wanted to participate. Homeless people can't rebuild their lives. Oh, this is fun. Homeless people should be housing ready first. That makes no sense. How would you become housing ready without being in a home? How do you practice that? You're just like, if we were going to make a baseball team, we'd be born ready to play. You couldn't practice. Makes no sense. No sense. And I think that was like a movement. I don't think it was too long ago, was it? Need to be housing ready first. Homeless people are lazy and could work. Homeless people do work. They work very hard. They may work for money. They work very hard to sustain their basic needs every day. They work much harder than I do. I can tell you, I've had patients who are doctors and lawyers and nurses and teachers and case managers, and I can't think of many of them who worked harder than the patients I see now work. My patients now are working harder to get better than any I've ever worked with. It's a joy. I feel very lucky to work with people in this situation. The motivation when you're homeless is pretty good. Homeless people don't want help. No, absolutely. They just want to take a part in it. They want to drive the car, which makes sense because that's their right. All right, so you guys know that pretty well. We got to get everybody else to know that. Because I think that we use these myths and we use these lack of knowledge about the stories and the faces and the facts so that we could not think about it. Because if we thought about it, we would know that we could all be homeless. Anybody here could be homeless. Me. Nancy could be homeless. Anybody here could be homeless. But if we try not to know anything at all about it, it helps us deal with that. But it doesn't help anybody else. We also have this problem with resources that are fragmented, and each being forced to look out for themselves and not connecting, so that we may actually have the dollars because it's cheaper than what we're doing now, so that means we do have the dollars, right? So why is it so hard to get it done? We have multiple fragmented resources, each needing to look out for themselves. So we got to have good people like Nancy pulling the puzzle pieces together. Another problem, 70% of homeless health center patients are uninsured. This is in the country. At our clinic, it's actually only 26%. And that's in Maine. And this is a great state. We have a great Medicaid system that does a really good job compared to other places. Now we talk about bankruptcy. Some people choose between rent and health care, which is a hard choice. What if you have your child has a terrible illness? Hard choice, right? A lot of people wind up homeless because of that. So what do we need to do first? What's the solution for the good health of people who are homeless? A home, right? Not a psychiatrist, not a psychologist, not a social worker, a home. We have to have a home. I went to this conference a few weeks ago, and there was this organization presenting called Common Ground. Has anybody heard of them? Well, they go into communities and pull the resources together, and then they go out and they talk to people who are homeless, and they find out their story and what they want. And they stratify the people who are most vulnerable, and they put all the community's resources together to house the most vulnerable people. This is a bridge, I don't know where, but at the conference they showed a bridge in New Orleans. And it looked just like this. There was that many people under the bridge. And they shared that they spent a week, they went to New Orleans, they put the community together, they did a half-a-day thing where they did stuff like this, where we learned facts and figures and got emotionally connected. And then they went out and they talked to people, they measured vulnerability, put all the resources together, and they housed 45% of the people by the end of the week in New Orleans. I doubt the Louisiana Medicaid system is as good as ours. Maybe. I bet we could do it here. Homeless people, 3 to 6 times more likely to be ill. So we'll move a little more into the health problems of the homeless. 3% report having HIV, 26% report infectious, acute type processes like tuberculosis, 46% chronic health conditions. That's people who report, probably more. And frostbite, trench foot, hypothermia. If you have one of these, eightfold chance of dying. 70 to 80% of people who are homeless smoke. It's roughly 3 times the general population. Smoking exacerbates everything. But it also relieves boredom. May help concentration a little, debatable, because when it comes out, it makes it worse. And that's the whole game with it. That's why it's the most addicting thing there is. In, out, in, out. May relieve anxiety, but then makes it worse on withdrawal. So you just smoke more. A lot of smoking, right? And people who are homeless die 3 to 4 times more than the general population. Young homeless women are 4 to 31 times as likely to die as housed young women. Average life expectancy, 42 to 52. It's about 80, I think, for us. It's pretty bad. This is a vulnerability index developed by a fellow named Dr. Jim O'Connell. Are you familiar with him? Boston Healthcare for the Homeless, one of my idols. He developed this index and researched it and found out that if you have one of these risk factors on the bottom here, then 40% mortality rate over 7 years. So you're dead, 40% of people are dead within 7 years. The index was end-stage renal disease, so kidney disease, HIV, liver disease, a cold weather injury like we talked about, hypothermia, frostbite. Greater than 60, 3 or more times in the ER in 3 months, 3 or more times in the ER or hospital 1 year, or what he termed trimorbidity, which is a cool sounding word, which means substance abuse, another mental illness, and a chronic general medical condition like diabetes. I think this image is really powerful. I'm not sure why. Yeah, this is what it's like. And I see people with feet like this. I do, and the feet are very important. In fact, one of the things we do for people is we have foot soaks to make them feel at home, feel a little better. Their feet may be okay biologically, it works psychologically too. So the feet of people who are homeless are at risk. Serious mental illness. A lot of this is schizophrenia, maybe bipolar, what we call schizoaffective disorder. The most severe of mental illnesses. 4% of the population in general, 20 to 25% of people who are homeless. And that's an important step. The other part of it is, if that's connected with homelessness, the chance of you being homeless for more than 1 year goes through the roof. Around 40% report alcohol use problems. Close to 30% report drug use problems. Close to 40% report mental health problems in general. Close to 70% report a combination. And 30% have this trimorbid thing.